Okay, so this video is going to be about the different types of fluid volume deficit. So first, untreated fluid volume deficit leads to the depletion of fluids available. That leads to a higher body temperature, dry mucous membranes, and difficulty with speech. The depletion of fluids that are available, cells then become unable to continue providing water to replace the extracellular fluid losses. This leads to some signs of circulatory collapse. So this is decreased blood pressure, increased heart rate, and increased respirations. And that eventually leads to restlessness and apprehension. So the first type is isotonic dehydration. This is where there's equal losses of fluid departments, so equal loss of fluid and solutes. This is the most common. There's no osmotic force created, and there's a normal serum osmolality or concentration. Mostly the extracellular fluid is lost. So some causes for isotonic dehydration is hemorrhage. So you're losing your fluids and electrolytes, you're losing proteins, and you're losing blood cells. Next is GI losses, such as vomiting, continuous nasogastric suctioning, diarrhea, fistula drainage, and they're all rich in electrolytes that are being lost. Next could be wound drainage, suctioning, then there's fever, environmental heat, extreme diaphoresis, shock, and in that situation, water and sodium is lost equally because this is isotonic. Then we have burns, which is damage to the skin and capillary membranes, and fluids, electrolytes, proteins, they all escape into the burned tissue, leaving inadequate vascular volume. Then there is diuretics, excessive loss of fluids and electrolytes, especially the non-potassium sparing ones. And then lastly, the third space, fluid shifts from vascular to the useless space. The next type is hypotonic dehydration. So this is a greater loss of sodium than the loss of water. So this means that the plasma sodium is decreased, extracellular fluid osmotic pressure has decreased, and then water moves from the extracellular into the intracellular, so into the cells. So a couple things can happen. So the amount of ECF has decreased, which means the blood volume decreases. This can lead to circulatory failure. It can also lead to renal failure. The water moving from ECF to ICF can also lead to cellular swelling, and then the central nervous system dysfunction with brain edema. And then another possibility is, the signs of dehydration. So that is for hypotonic dehydration. The third type is hypertonic dehydration. So this is where more water is lost than the solute or the sodium, mostly going to be sodium. This creates fluid volume deficit and a relative sodium excess or hypernatremia. Creating a similar imbalance is when you're gaining extra solutes or you're taking in excess sodium. So it's not always losing the water, it might just be taking in more sodium. So the serum osmolality increases, resulting in hypertonic extracellular fluid that is pulling the fluids into the vessel from the cells by osmosis, which is going to cause the cells to shrink like raisins, and then they become dehydrated. So some causes are inadequate fluid intake, severe or prolonged isotonic fluid losses, watery diarrhea, whereas there's more water than electrolytes being lost, diabetes insipidus, which is insufficient ADH or antidiuretic hormone, which leads to massive urination. And then lastly, increase of sodium intake is going to cause this too. So that's hypertonic dehydration. For treatments for fluid volume deficit, you're going to replace the fluids, whether it be oral or IV. So for isotonic fluids, you're going to use that for isotonic dehydration or for true hypervolemia. And then it says for low sodium, hypotonic, which is 0.45 normal saline, for hypertonic dehydration. If someone is hypotensive, you're going to lie them flat and elevate the foot of the bed. And then you're going to do daily weights, you're going to do strict I's and O's, you're going to use meds, maybe antidiarrheals, maybe antipyretics. So the people that are most vulnerable are the people that are most vulnerable for everything like infection. So there's children and infants because they have a higher concentration of water, so they're more sensitive to the losses. They also have immature kidneys, which cannot regulate water or electrolytes. And then there's, if you're obese, you have very little water in your fatty tissue. Water is mostly stored in lean tissue. So that, and then as well as having a higher body surface area, means you're more vulnerable for fluid volume deficit. And then lastly, the elderly, because they have a decreased thirst, they could have cognitive impairment, they could have dependence and can't get water, can't get to the kitchen, and then if they just have chronic health issues in general. So those are the people that are most vulnerable for fluid volume deficit.